Post-traumatic stress disorder. Class, today we will be discussing post-traumatic stress disorder, PTSD.
What is post-traumatic stress disorder? What are the causes?
Post-traumatic stress disorder is a debilitating mental disorder that usually follows experiencing or witnessing an extremely stressful or traumatic event, such as the death of a loved one, accidental and natural disasters, and war. It usually occurs due to an overload in the individual's usual coping abilities.
Interesting.
Mrs. Green, what are the symptoms of PTSD?
The symptoms of PTSD may include the re-experiencing of the traumatic event, where the individual recollects the trauma through intrusive thoughts, images, upsetting memories, and flashbacks. The individual responds as if they are reliving the event, and intense physical reminders such as rapid breathing, a pounding heart, and sweating are evident. Another symptom of the disorder is avoidance and numbing, where one avoids activities, places, thoughts, or feelings that remind them of the traumatic event. There is also an inability to remember important aspects of the trauma. Also, there is a feeling of detachment and emotional numbness.
Sounds frightening, Mrs. Green.
A third symptom of the disorder is increased anxiety and emotional arousal, where there is difficulty falling or staying asleep, increased irritability, hypervigilance, jumpings, and easily startled, as well as difficulty concentrating.
Can post-traumatic stress disorder be treated? I read an article that antidepressants, anti-anxiety medications, and beta blockers are useful in controlling the physical symptoms of the disorder.
Yes, Andy. Psychological treatments have also found to be effective in treating the disorder, such as cognitive behavioral treatments, which focuses on changing the way these individuals feel, think, and respond to situations. Psychodynamic psychotherapy is another treatment choice and focuses on factors early childhood experiences, current relationships, and emphasizes the role of the unconscious mind in our behaviors.
Mrs. Green, apart from medications and psychological treatments, are there any other remedies?
Yes, Cindy. Other remedies include support from family and friends, relaxation methods, and challenging one's sense of helplessness.
Mrs. Green, what is the incidence of PTSD in Jamaica?
Studies of the general population suggest that about 7 to 8 out of every 100 people, or 78% of the population, show signs or symptoms of PTSD. Women experience PTSD 2 times the rate of men, and are 4 times likely than men to experience long-lasting PTSD. Data indicates that the combined risk of trauma exposure and PTSD may be influenced by genetic and the environment.
Wow. Thanks for the information. Now I have a better understanding of the disorder.
That's it today, class, on post-traumatic stress disorder. Thank you.